You're slowly getting better. I'm Arvin Arthur. I'm an interventional cardiologist. I'm going to just take a listen to the front side here if I can.
Okay.
I interned in Des Moines, Iowa, and then spent 2 years in the military, and then came to California in 1976, and have been practicing cardiology here in Sacramento since that time. What I enjoy most about my job is taking care of patients' heart disease, basically seeing them go through, finding out what their problem is, and then seeing them get better. It has been exciting in cardiology over the last 30 years. When we look at going from balloon angioplasty to drug-eluting stents and where we are today, there's no question that now patients are having better outcomes, and it has been exciting to be involved. Mercy General Hospital does stand out in its care for cardiac patients. It stands out not only in terms of cardiac catheterization, coronary intervention, but it also stands out in open heart surgery. And Mercy General Hospital is one of the best hospitals that you could come to for treatment of your heart disease. Let's go to 20 right there.
Okay.
People in the cath lab, the techs, the nurses, the physicians are experienced and have the volume here to hone their skills, and they will get the best care that is available. When a patient comes into the cardiac catheterization laboratory, they're going to see a lot of equipment. There's lots of light, and you've got a pleasant group of people to work with. All right, we're going to start with just feeling your pulse as usual. The patients need to know that they are going in for a cardiac catheterization. Okay. We don't actually have to make any incisions. Basically, we're using a needle to go into the vessel. We put a little thin floppy guide wire through the needle into the vessel. And now we use a dilator and sheath to go in, and we don't make any incision. Cardiac catheterization includes putting catheters in the heart and taking pictures, which is frequently called an angiogram. This is a diagnostic test, so that this is going to give us information about what the problem is. The aortic valve is more narrow than it has been in the past.
Yes.
But your heart is working okay. The other bypasses are open. Okay, so we'll go ahead and repair this stent. If we go further in terms of an angioplasty or putting in a stent, this is now a therapeutic procedure. A patient having a diagnostic examination will usually only be in the cardiac catheterization laboratory for 30 or 45 minutes. Looks like you're resting comfortably here. Okay, good. We're all done.
Oh, good.
Okay, so we got that stent area nice and open again. It looks
Great.
Beautiful. The recovery time will be in a period of 4 to 6 hours, waiting for the area where the catheters are put in to seal off. And they potentially would be going home that same day.
Thank you, guys. You're welcome.
The patients having therapeutic procedures stay overnight. After the procedure, my role is to make sure the patient is stable, comfortable, and I will go out and talk to the patient's family and make sure that they know exactly what has occurred. How's your breathing this morning?
Feels fine.
Okay. And any chest pain? My role the next morning is to be sure to talk to them and any family about what has occurred and where we're going from here. Whatever we need to do, whether it is medical therapy, angioplasty, stents, or even bypass surgery, is to try to treat this disease the best possible way so that then the patient can have the best quality of life and hopefully a long life.